Whether you're looking for answers to specific life questions or seeking to become the best version of you possible, welcome to the Mental Breakdown and Psychreg podcast, where we offer insight, information, and strategies based upon research and years of practice as clinical psychologists. So sit back, have a listen, and get connected with our hosts, Dr. Berney Wilkinson and Dr. Richard Marshall. Welcome back. Richard, today we get to talk about a very common, well, at least a condition that people believe is very common, social anxiety.
I think it is.
Well, I think that a lot of people confuse shyness and all with social anxiety, and there's quite a difference between shyness and introversion and what is really social anxiety.
And true anxiety.
Right.
Anxiety sort of in a clinical.
Right,
okay.
Right. Clinically speaking. Mm-hmm. But we also, not only do we get to talk about that, but we get to talk a little bit about the brain. And I know that you like to talk about the brain.
Always a good topic.
That's right.
Okay.
So we read a what?
I have a question.
Okay.
Am I sitting properly?
Well, it's
no,
better.
I mean, is this how I should be?
It's getting better.
I can't remember whether I'm supposed to go this way or the other way.
Yeah.
This way?
That's better.
Okay.
That's better.
Because when we talk about the brain, I have to get geared up.
You do? Yeah. Well, we are referring to an article that was in online at socialtransformation.us. Mm-hmm. And so we'll include the link in the show notes. But it's talking about social anxiety and the amygdala. Right. This very nice little section of our brain, little area of our brain connected to the hippocampus, which is all about memory. But the amygdala is all about emotion.
So as soon as you talk about the amygdala, we know we're talking about reactivity.
Right.
How we react.
Right. Especially
to danger.
Right.
Because the amygdala is the structure in the brain that tells us that we are in danger.
Right. Right. So there's a lot of emotion connected to the amygdala, which is, just for those of you who are amateur anatomists out there, the reason that we remember emotionally charged events so significantly, so detailed, is because the amygdala is right next to the hippocampus, and the hippocampus, of course, helps formulate memories.
I was going to mention that. You sort of casually mentioned that it's next to the hippocampus, but there is there's a significance to that, anatomical significance,
right? Because
you want to remember what's dangerous,
right?
And otherwise,
right,
you do dangerous things. I shouldn't say stupid things. You do dangerous things, and you don't realize.
Too.
Wow. They are.
Stupidly dangerous?
No, they are. Because you want to remember what's dangerous. Right. So the hippocampus is right next, the amygdala sits just in front of the hippocampus.
Right, right. And there's some connection, of course, with that, with things like PTSD, and all, because if there's a subtle cue that the amygdala can recognize that is associated with something dangerous, then it's going to put us into fight or flight, which is, in some ways, fight or flight is very, very similar to a panic attack or to an anxiety attack, however you want to refer to it. And that's what we get with PTSD, where sounds or smells or sights, visions of something will trigger a panic attack because of a past experience.
Okay. So in this article, he's linking social anxiety to the amygdala.
Right.
That's the whole point. Okay.
Right.
Got it.
And so it's for many of the same reasons. The concern is that for various reasons, people with social anxiety tend to view social situations or interactions with other people as dangerous experiences.
Right. That's right. They see it as a threat.
Right.
I mean, and I think one of the easiest ways to think about this is the fear, the absolute fear that some people get when they have to do a presentation in front of a group.
Right.
That would be a not necessarily social anxiety as we define it clinically, but that's the feeling that you get, that sort of panicky, anxious feeling that you get when you have to do a talk in front of people.
Right.
And it takes a lot. Barbra Streisand never got over that. She entertained for 50 years, and always had stage fright, always had performance anxiety. So it's not an easy thing to get rid of, because this author says the amygdala hijack, and your brain is always going to win.
Right.
You can tell yourself it's okay, but if your brain's telling you you should be afraid right now, you're going to be afraid right now.
Now, I didn't know that you were going to mention the Barbara Streisand thing, because I think that that's an important discussion to have. Is stage fright, is a situation like Barbara Streisand had, is that really social anxiety?
No, I don't think it is.
Right. Because I think that what happens is people, either like Barbara Streisand or like a lot of other people, they'll talk about they'll talk about they have this social anxiety and they can't. Well, if you can perform something in front of thousands and thousands of, you don't have social anxiety. No. You have stage fright. You have performance anxiety, perhaps, but you don't have social anxiety. Right. Social anxiety, if you're a student in school and you have social anxiety, walking through the lunch line is a feat. That is a very challenging thing, because you're walking through the lunch line. Everybody can see you. You're walking in front of a large crowd of people. People are talking to you directly, and so the anxiety comes that I'm going to say something wrong, I'm going to do something wrong, and that's that's social anxiety.
It's funny you should mention the student, because there are students, you and I both teach at the college level, who find it extremely difficult to just go to class,
right? Because
it's a social setting.
Right.
And they describe it as when they even the anticipation of walking in the room creates anxiety.
Right.
Walking in the room creates anxiety.
Right.
Being in the room, and they say exactly those words, that I feel like everybody's watching me.
Right.
Though they understand they're not.
Right.
But that's the feeling that they get.
Yeah.
And you're right. Barbara Streisand wouldn't be able to even walk into the theater if she had true social anxiety.
Right.
I mean, she'd be drenched in sweat.
Right. Right. And so true social anxiety is different than shyness, different than introversion. Those are very different things. So, but in this article, what he talks about is that the amygdala in some ways hijacks this whole system, and maybe we should do a longer podcast sometime to actually talk about how that mechanism happens, because while it is the amygdala, the cascade of events doesn't start with the amygdala. Right. The amygdala is sort of he's the one that sort of puts the stamp down to send us into fight or flight. But all of that really starts with the thalamus and the hypothalamus. I mean, it starts at the core of our brain, where our senses first start to even get into our brain.
Yeah, and what's supposed to happen is information should come from the thalamus, because the thalamus receives all these sensory
Grand
inputs.
Central Station.
Right, yeah. It is right at the center of the brain, a little egg in the middle of your brain. It receives all the stuff, and it should send it to the neocortex and other places. Curiously, in teenagers, it always goes to the amygdala first, and then so a teenager will always react emotionally, because the circuits to the frontal lobe haven't developed yet.
Yeah.
So it goes thalamus, amygdala, cortex, rather than thalamus, cortex, amygdala.
Right. So the thalamus is almost like a brain within a brain.
Right. It's Atlanta.
Especially as we get older, because it makes some decisions.
It does. Where do I send this?
It's
the transmitter. It's like these big transmitter towers, and everything comes flooding into it. And the amygdala, the thalamus, decides, where does this go?
Yeah.
Is this vision? Is it touch? Is it hearing?
And
where do I send this?
It says, oh, that looks dangerous. Let's send that to the amygdala first.
Right.
And then that's when we get into fight or flight. And so, we should do a longer podcast sometime to talk about that.
And we can start with why zebras don't get ulcers.
We could do that.
That would be our beginning.
Yeah.
Interesting question. Why do zebras not get ulcers? Has to do with the amygdala.
Because they don't have to go to school.
They don't have to take the FSA.
They don't have to take standardized tests.
Right.
But so in the article they talk about 5 ways to help deal with these issues, and of course one of them is medication.
Yeah, if your brain gets hijacked like this, if you're the kind of person whose brain gets hijacked, here's 5 things you can do about it.
Right. So the first one is medication.
Right.
Now, typically speaking, medication is not advisable for social anxiety. Social anxiety is, in many ways, it's a very broad phobia. I mean, when you think about,
it's a It's a generalized phobia.
Yeah, it's a phobia that isn't so specific like snakes or spiders.
Spiders or
It's a generalized to social situations, and of course, because we're social creatures, it involves a lot of other things. But and when we talk about phobias, generally speaking, medication isn't used because
for phobias,
right? Because you can typically avoid those types of situations, and you don't have to be in. You don't have to fly. If you're afraid of flying, you don't have to fly. So medication for social anxiety really isn't. It's effective, but it doesn't really resolve the issues. It doesn't really solve the problem.
When people who have social anxiety, the symptoms, the sweating and the heart palpitations and the blurred vision and all the symptoms you get, we understand that they want immediate relief.
Right.
And when you want immediate relief, you think of medication.
Right.
But actually, as this author says, medication is really a last resort.
Right.
There are other things you should do. If nothing works, then there are medications you can take.
Right.
But you shouldn't expect the medications to fix it.
Right.
Right. I think that's the important message.
Yeah.
And the medications are the same thing we use for depression.
They are the SSRIs and other antidepressant type things, but also the benzodiazepines. I mean, he doesn't mention it in there, but the benzodiazepines that calms it
but
quickly.
What do you think about? I mean,
again, that's a discussion for a longer.
When you're talking
podcast.
about Valium and Xanax and those sorts of things, and those are, we need to do a separate podcast on those.
Oh, absolutely.
Yeah, let's do a separate.
That's a great idea.
My daughter. Well, let's do a separate podcast.
That sounded like you started to get into some.
Well, it's the drug of choice to abuse in colleges today.
Right.
Parents are worried about marijuana. Parents, don't worry about marijuana. Worry about Xanax.
Yeah.
And don't worry about alcohol. Worry about Xanax.
Yeah. Or Xanax with alcohol.
It's a much larger problem that I'm aware of because my daughter who is a college student, has informed me of that. But we need to do a separate talk about that.
Yeah.
Now, let's have a benzodiazepine day. Oh, I know.
That sounds like a party.
We should invite one of our psychiatrist friends to come in that day.
That'd be good.
Be interviewed.
Yeah. Maybe we'll
talk about
Let's put that on the list. The second strategy that's discussed here is meditation. And we've talked about it many times before. And in fact, I was just talking about it with some patients yesterday that, when it comes to I always liken it to the cup analogy. You have a stress cup that can only hold so much. And if that cup gets too full and begins to overflow, you get into this fight or flight, you get into this anxiety response.
Yeah, you reach a tipping point.
Right.
That cup fills up. It
overflows. And so what meditation does very nicely is it keeps the volume of that cup low.
Right.
It helps keep that down so that when you do get into those stressful situations, it doesn't overflow. You can still manage, you can still work it out. And so meditation, from a physiological perspective, just helps calm that amygdala down.
Right. Yep.
We like to think of it as a sort of a fire going on in there, and meditation helps cool that fire down.
Right. You gotta lower the temperature.
Yeah.
Okay.
Now the third thing is sort of a very classical approach, and that's exposure therapy. And so what you do is, of course, you put yourself in a situation where you can manage it. Now, what I do with patients is I combine meditation and relaxation with exposure therapy. So, you work over a couple of weeks to really build those skills in relaxation and stress reduction. And then you put yourself in a situation where you have to be, you're in that stressful situation. So you have to go in front of people and do something very briefly, just for a couple of minutes. But you practice those relaxation techniques first, engage in the behavior, and then use those relaxation techniques afterwards, and you gradually build and extend those times, and the tolerance builds. Right.
My daughter has an absolute deathly fear of frogs, and she even refuses to do exposure therapy. She's so afraid. She said, I don't even want to talk about it. It makes me nervous just to talk about it.
That is something that I wish that I had known for so much.
No. She's graduating in a couple of weeks. You could get her a frog.
Just wait.
No, she is absolutely terrible. She was visiting a few days last weekend, and we discussed it again.
You wait, Miss Marshall. You wait.
So yeah, she said, I know. I don't want to talk about it.
Mm-hmm.
Oh, substance abuse.
Number 4, minimizing substance abuse. Now, we were just talking about benzodiazepines because benzodiazepines are abused a lot with people with anxiety disorders. But other substances are abused as well, especially alcohol.
You have to be so careful. If you have any kind of anxiety, you have to be so careful with drugs because some of the, I'm sure you're going to say this, there are certain drugs that do work that will make you less anxious.
I was going to say that.
I mean,
I was going to say, well,
how do you not take them?
I keep saying the word physiologically. Physiologically, alcohol and Xanax behave almost the same in our brain.
Same, right.
They work on the same neurotransmitter system, which is why it's so dangerous to take alcohol and Xanax together.
You double the dose.
Yeah,
worse.
It's a synergistic effect, right? And so that's why we get a lot of the problems. When you think about date rape drugs and things like that, it's they behave similarly.
Well, college students are combining alcohol and Xanax, and the Xanax and the Xanax. The effects of Xanax are much worse than the effects of alcohol alone. Right. It's a horribly dangerous combination.
Right.
Because as you say, a college student, when I talk to college students about their drinking, that's I have 6 or 7 or 8 beers, but if you're taking Xanax, you're having 9, 10, 12 beers or more.
Right. Because
and if you're drinking whiskey or vodka, it's even worse.
Man, you're going hardcore with that.
It's bad.
Well, so just a simple example, if you drink enough alcohol to get you to a level 2, and you take enough Xanax to get you to a level 2, the combined effect isn't a 4. The combined effect could be a 20.
Maybe that's right.
And so that's what we call
it doesn't just double it.
Right. That's what we call a synergistic effect.
And
it significantly increases. Yeah, and so that's what makes it so dangerous. So minimizing substance abuse, not just for that reason, but also because those substances can potentially do harm to our brain and make those symptoms worse.
But this is what is so difficult, and parents in particular, or adults who are dealing with this, but parents who are dealing with your children, they will want to smoke weed.
Right.
Because weed will calm them down.
Right.
And it's very difficult. It's an uphill battle to try to convince an anxious teenager not to smoke weed because it does work.
Right.
Unfortunately.
And again, it works, but it's not necessarily safe. It's not necessarily without.
It's not the solution.
Other problems, right?
And that's what we're saying here is it's not this any more than therapeutic. What was the first thing we talked about? Therapeutic medications are not the solution.
Right.
Neither is weed the solution.
Right.
I mean, you can't. Well, I have a talk today till I'll smoke a joint or two. It's not the solution.
Right. Absolutely. So now the last one is cognitive restructuring. Right. And so this is sort of a reframing. This is a putting the pieces together in a different way so that you process it differently. And we've talked a little bit about it as part of like cognitive behavioral therapy, and more recently with sort of metacognitive therapy that we've been talking about, really just thinking about those issues differently. When you go through the lunch line, are people really looking at you?
Yeah.
And it's difficult, but you work through that process. And I think that because we use such an eclectic approach here, we combine a lot of these things, whether it's the meditation and relaxation, the exposure therapy, along with the cognitive restructuring. When you combine those pieces together, you really find much more benefit to what you're trying to do and more improvement.
And people need to remember that these cognitive approaches take some time, before they're effective.
Right.
You have to work at it. You have to practice it. You do it 2 or 3 times, you're not going to convince yourself of anything.
Right.
You got to stick with it.
Right.
But as we've always said, medications take weeks or months to work too.
Right.
So it's not like it's any slower than medication effects.
Right. Now the last point we're going to make today is a disagreement with this article, and that is when you do any of these things, you're not changing the structure of your brain. The person who wrote this article refers to that several times, rewiring it, restructuring it, shrinking it.
Right.
Yeah, we're going to add the link.
And so because we're sending you this article, they use the word change the structure.
Right.
And it really doesn't change the structure.
Right. And the reason that it's important that we point that out is because many people will find that you start working on these things and you'll find improvement. But then 5 years down the road, you could be doing something and it will spark back up again.
That's right. You'll trigger it again.
And you have to go back to and use these strategies again.
Right.
But if you change the structure of the brain, then those things should not, theoretically, those things should not come back again. And we know that they do. So don't be disillusioned that, okay, I can just, if I do this thing, it's going to change the structure of my brain and it's going to make it go away forever, because that just doesn't happen.
No, the amygdala, the thalamus, the hypothalamus, they're all there, and they're all going to do what they always have done for hundreds of thousands of years.
Right.
They all perform an adaptive function.
Right.
You don't want your amygdala to stop warning you that you're in danger.
Right.
Otherwise, you're going to be.
Right. Yeah, they're not going to shrink. They're the size that they are,
No.
and they're going to stay that size. They're not going to change that way. You can gain better control of them.
You're gaining control.
But that's about all that we can do, and that's all we do anyways. Whether you have that issue or not, all of our amygdala want to behave that way, but our cortex has to gain the ability to keep it under wraps, and so.
And here you can think about a Buddhist monk. When we talk about the monks who gain control over their heartbeat or their respiration.
Right.
But it takes years and years and years of work.
Right.
And you can. So don't expect this to happen quickly, but it will happen.
Right.
But you're not changing your brain.
Right.
You're changing the way information moves around in your brain.
Absolutely. So, all right. I hope that was helpful.
Good talk. Yeah.
We'll be back next time with some other stuff.
Okay.
And we still have to think about that longer podcast about
You have
the
to write
amygdala
that
a little
down.
bit.
I'm going to write that down as we speak.
Well, and while you're writing that down,
I'm going to say...
I'm going to say, stay happy, stay healthy, and forget to be afraid.